And we are live, Dr. Emer.
Hey guys, it's Dr. Emer. We're here on the weekend on our one Saturday clinic a month where we're doing something really great. We have Shawny here who does aesthetic tattooing, and I'm going to show you guys because you guys know how often I treat scars, and I had so many patients who come in for scars and burns, not just acne scars. And actually we got our first ever private clinic to get a 501(c) tax non-for-profit organization that we're going to start next year for scars and burns to help patients get treatments like lasers and tattooing. We'll be raising money for it shortly in January, so all you out there that have some that want to donate, let us know. But what we're going to be doing in those types of things are lasers to treat scars and burns, but also treatments like this where you have aesthetic medical tattooing. What is medical tattooing? This is where you camouflage scars, and we've already done actually some injections with silicone to help lift the scar because it was indented. Now we're using tattoo pigmentation to basically camouflage the color of the scar so it just looks more like his natural hairline without doing any hair transplant. Do you want to tell them a little bit about it?
Yes, definitely. Hey guys. So basically what we're doing is we're mimicking hair follicles. So if you look closer.
Look really close here. Some of these are actually not hair follicles. They're actually pigment in the scar, which is unbelievable. If you look at this part of the scar where it's not done, look at how white, and you can see there's much less hair follicles because it's a scar. But if you look right here, where a lot of the tattooing has been done, it's almost looks like his hairline.
Yeah,
and it looks like natural hair. So show them what it is. You actually use real pigment?
Yes.
So tell us about the pigment. What is it?
So we're using tattoo pigment, of course, because that's what we're doing. But we diluted it so it matches his actual hair follicles. And as you could see, I'm blending it with the sorry, my mask.
So you are literally going above and beyond. You're following the hair, the way in which the hair grows to mimic the follicles, basically.
Right.
And that allows it to be more natural. What do people normally do?
So if someone had a scar, they would literally just go into the scar line as opposed to blending it around. So now, as you can see, if you look closer, you can't tell where the scar is now.
It's going to blend it in. It basically camouflages it.
Exactly.
So this is medical camouflage.
Yep.
And what happens if this isn't done right?
Then it actually will look worse. And you can see, you can definitely see where the scar is, right? I believe.
That's amazing.
Now, why is this better for the head versus laser?
Well, here's the thing. In this case, because he's hypopigmented, there were two issues. One was it was indented. So we lifted the indentation by doing subcision, where we take a needle and break apart the scar and lift it up. And also we put a permanent filler there called silicone, which I know you guys have a lot of opinions on, but in very small quantities it can be done safely to improve these traumatic scars like this. And then the last part now, we probably only need to do that one more time, maybe, we'll see. Now it's hypopigmented, meaning it's white because there's a scar that healed there and the hair follicles are not there. So we have to camouflage it to look like it has hair follicles in there. We can laser it at some point, but then
point out the part before it where
so this is where there's no hair follicle or no tattoo pigmentation. It's very white, okay? But here you can see it's starting to be blended in. So zoom in there, you can actually see. It'd be very hard for the average person to be able to tell that there's tattoo in there. I mean, it's pretty awesome.
Can this work on someone, let's say, with like a tummy tuck?
Yes.
Yeah, you can camouflage dyspigmentation like
what about burn scars?
Burn scars, yeah, you should tell them your Instagram so they can go look at it. Tell them.
Yes, it is Exquisite Aesthetics is my Instagram. I work on skin grafting, tummy tuck scars, stretch marks, whatever kind of scars you have. I am the perfecting session.
So she is the finishing touch, you guys. That's what I'll call it. You see here? So we work together to collaborate because I want people to get the best outcome. Sometimes one person can't do everything. This is a very unique thing to be done. It can be done on breast scars after you've had breast surgery or even breast cancer surgery, not just cosmetic. It can be done on burns. It can be done on traumatic scars. If you've had an accident and some of the scars have discoloration and they can't be lasered anymore, at some point laser, filler, subcision, or even surgically revising them may not be enough. And in this case, this is the next step. So she's going to be going a while to really blend this. I mean, this is artistry. It's like an ice sculptor. You know, it takes time and then you finally see the outcome. So she's working diligently to blend. I love it. Just show that process.
So here's an interesting question. So hello, if we do permanent makeup, we don't work on scars. Why can't it done with this procedure, or what can be done with this procedure? Maybe that's what they want to ask.
I'm not sure if that
Wait, say that again.
If we can do permanent makeup, we don't work on scars.
They do
Why?
permanent makeup, but they don't work on scars.
It's
So how did
actually
you
the
learn?
same. It's the same license. It's a body art license, and you would need advanced training, and I do training as well.
So she does training, but you obviously you don't just, if you do permanent makeup, you don't just start doing scars. You have to take time
To train, yeah.
to understand and learn how to do it, which is what she specializes in. So Shawny is an expert in the art of treating burns and scars and traumatic injuries and things like that. So let her show you and tell you a little bit more about the procedure, and in case you guys want.
Now, what's the
information.
downtime on this?
Nothing.
So he just leaves after, like he's fine. You put on a hat.
Yeah,
It's
you
like-
want to keep it clean because it is an open wound, so you don't want to go in with a dirty hat or anything like that. You don't want to be out in the sun.
I tell people after you get tattoos, we have a whole protocol of using a silicone gel, a growth factor, and a stem cell. All that not only prevents infection, but also helps them heal. It also allows the tattoo pigment not to ooze out or become hazy, because you want it to be very precise. So using that, you can get emeragecosmetics.com. We actually have a post-tattoo package because I'm so specific about using specific products afterwards. The Hyla B from my Emerage skin line actually helps us heal really fast, and so does the Refit face. So just show them a little more and then we'll go.
Yeah. So come on closer.
My dad is getting a neck stretch today for sure. Should have brought in our massage therapist to do the other side while she's pressing this. But see how she's blending kind of all around. She's being very specific. Sorry.
See?
Zoom in there, you can see that pigment.
And then you can see the difference. You guys see the white part versus the part where he's been tattooed. So
So that's it. So
That's it.
that is medical tattooing, you guys, for scars. So stay tuned again as we give you more education.
and then before we leave, tell us what can we do with this? Like burn scars. What else?
We can treat burns. We can treat grafting. Mommy makeover scars, breast scars, if you've had breast reconstruction or breast cancer. We do it for pigmentation issues. And again, you can also do just permanent microblading or tattooing of brows, lips, and other things. So contact us, jasonmrmd.com, or appointments at jasonmrmd.com, so that we can give you more information on what we do with Shawny. Bye, guys. So how long does this normally take you to do, like the whole thing?